Hello and welcome to the podcast. In this episode, I'm going to be talking about grief and specifically prolonged grief disorder. Now, if listening to someone talking about grief isn't exactly your cup of tea, which I totally understand, then this probably isn't the video for you. If, however, you would like to find out more about prolonged grief disorder, and as an aside, a lot of people have never heard of it, then this could be a video that's worth watching. So let's begin. The Lancet. Prolonged grief disorder is a mental health disorder recently included in diagnostic manuals worldwide. Now, that inclusion is really important. That is so useful. It is so good that it has been included in these diagnostic manuals for reasons that we'll come on to, but maybe already you can figure out why that could be a good thing. From this article, signs of prolonged grief disorder. It is defined by profound and debilitating feelings of loss. The condition has also been referred to as complicated, traumatic, chronic, or pathological grief. The hallmarks of prolonged grief include significant emotional distress and changes to a person's level of functioning. The article goes on. As a society, our experiences with grief are becoming more prevalent, so much so that the mental health community have added prolonged grief disorder to the text revision of the Diagnostic and Statistical Manual of Mental Disorders 5. So the DSM-5 TR, text revision, the American Psychiatric Association's Handbook for Mental Health Disorders. And as already mentioned, other handbooks have included prolonged grief disorder as well. This article goes on. How can we define it? What are some of the signs of this prolonged grief disorder? Intense emotional pain related to the death, e.g. anger, sadness, helplessness, a marked sense of disbelief about the death, difficulty reintegrating or reconnecting with relationships and activities after the death, emotional numbness, struggling to find meaning in life, intense feelings of loneliness or detachment from others, identity disruption, e.g. feeling as if you've lost part of yourself. Now, as I read that, you may be thinking, well, I know people who've felt that, I've felt that, and I have felt that more than once. All of these, some of them not as much, some of them quite intensely, but I haven't been suffering from prolonged grief disorder. So as we go on, we'll find out why and how we can differentiate. And as I say, this is not to suggest that any of us who've experienced grief haven't felt these things and other things as well. But there's something that differentiates it, which we'll get to. So from the American Psychiatric Association, an estimated 7 to 10% of bereaved adults will experience the persistent symptoms of prolonged grief disorder. Some of those described earlier. Among children and adolescents who have lost a loved one, approximately 5 to 10% will experience depression, post-traumatic stress, and or prolonged grief disorder following bereavement. So it's not only adults, it is sadly children and adolescents as well. Some individuals may be at greater risk of developing prolonged grief disorder, including older adults and people with a history of depression or bipolar disorder. Caregivers, especially if they were caring for a partner or had experienced depression before the loss, are also at greater risk. You kind of see why. It's been such a big part of their life. And if you've done any caring, you'll understand that. The risk of prolonged grief is also greater when the death of the loved one happens very suddenly or under traumatic circumstances. Now, that makes sense as well. It's the shock of the change. Prolonged grief disorder often occurs along with other mental disorders such as PTSD, anxiety, or depression. Sleep problems are also common. An estimated 80% of people with prolonged grief disorder experience long-term poor sleep. And you can understand why. Their world has been turned upside down. How can they process that? How can they make sense of it? Then, let's go on to listen to a couple of people, Catherine Shear and Holly Priggerson, who are going to talk about not only prolonged grief disorder, but but it in relation to its addition to one of the diagnostic manuals, in this case the DSM-5 TR.
There are major benefits to bereaved people in having this diagnosis. For example, more knowledgeable mental health clinicians. Right now, we don't have those. Greater access to services, both because we have people understanding how to treat people and also because they'll be paid for. Greater public awareness and recognition is a huge benefit, and a way to benchmark research and communicate clearly among ourselves.
What makes this different from normal grieving is, even though the symptoms appear very understandable, yearning and pining and missing the person desperately, that seems pretty normal after the loss of a loved one. But what we find is that those people who are really stuck and have intense levels, even at the very beginning, very intense levels, where they don't know who they are without this person anymore, those people, oftentimes, a small minority, about 4%, will not get better. They'll just spend and eke out the rest of their existence missing this person and wanting to be reunited with them. And that part is not helpful. It's not helpful to ignore the fact that some people get stuck and could use some assistance and support in reintegrating into a life without this important person who died.
Being able to categorize prolonged grief disorder, being able to say to someone, hey, this is different from other types of grief, being able to put the individual together with the person or people who can help, who have the right expertise because they know all about this area, this subject, is essential. And that's why I say it is so important and so good that these manuals are now recognizing this as a distinct, discrete disorder. And I would add into the mix, what we're seeing here in part is, well, it's the map of reality that we all have. We all have a version of reality in our heads, and it's in a state of flux. It can be updated, things can be added, things can be deleted, things can become more nuanced. It is malleable, and that is a good thing. But when we have someone who has been an intrinsic component of our internal map of reality, and suddenly they're not there, or over time they disappear, but they're gone, then that can be really difficult for us to contemplate, because we have to update that map, and that can be extremely, well, challenging for a lot of us. And if you've gone through that loss, then you'll know it takes time, and it can be odd and even weird at times, and of course painful, and of course sad. But for some people, that updating, the ability to move forward with this new map of reality, when that individual isn't there, at least in the same way, they may be somewhere, if that is your faith, they may have gone somewhere else, but they're not in that physical realm, then not only can it be difficult and challenging and draining for all of us at times, but for some people, they can't update the map. They can't update it. They need help. They're stuck in different ways. And that's my take on it. And others may disagree, but I think it can be useful to consider. So let's then move here to this article: Prolonged Grief Disorder, Course, Diagnosis, Assessment and Treatment, to hopefully put more understanding out there in terms of the differences between grief and prolonged grief disorder. The loss of a loved one is among life's most challenging yet common stressors, resulting in the cascade of emotional, cognitive and behavioural responses that define grief. Trajectory models assessing the course of grief following a loss for up to 3 years post-loss have identified several patterns. The most common trajectory following a loss is stable, low levels of grief symptoms. This trajectory occurs for approximately 26% to 45% of bereaved individuals. In addition, many individuals will experience high, this is 16 to 20%, or moderate, 30 to 33% levels of grief immediately post-loss that decrease over time, often without intervention. Furthermore, a small subgroup of individuals may develop grief later, showing low levels initially and higher levels 6 months post-loss. This trajectory has been reported for some bereaved partners. Finally, a minority of individuals, approximately 7% to 10%, will evidence stable, high grief trajectories. This subgroup probably represents the subgroup with a prolonged grief condition and will likely warrant intervention if persistent symptoms are linked to distress or functional impairment. Let's see if we can differentiate a little bit more between prolonged grief and so-called normal grief. Prolonged grief is not the same as normal grief. There are differences in time, intensity, and effect upon daily functioning. Normal grief slowly fades with time, making it possible to move on with life while accepting the loss as real and important. A large majority of people are able to resume some normalcy in their lives at a point between 6 months and 2 years after the loss of a loved one. Periods of sadness might reoccur at certain times or even daily beyond the 2-year point, but it is not experienced as a constant yearning or longing for the deceased. Grief is considered to be prolonged when the bereaved is having severe symptoms which interfere with their daily life more than a year after the loss. These symptoms might be based in a refusal to accept the death, such as setting a place for the deceased at a dining table or keeping their clothing as if the items are still needed by the deceased. Sometimes the longing to be with the deceased is so strong that it leads to suicidal thoughts. Others experience a persistent emptiness or numbness which doesn't let up years after the death. It is estimated that almost 10% of grievers have severe symptoms beyond the 1-year point, leaving them feeling stuck and miserable. And that could fit with the 7 to 10% figure that was mentioned before. We may also manage to clarify in more detail what prolonged grief disorder is when we look at it in comparison to depression. So from this article, a key assessment to distinguish prolonged grief from depression involves whether the thoughts and emotions continue to circle around the deceased, prolonged grief, or whether these are more free-floating and generalized and less associated with the loss itself. Depression. For example, a low mood, dysphoria, and prolonged grief will be associated with the separation from the deceased, while depression will involve a more persistent and pervasive dysphoria, often in combination with pessimistic rumination and a sense of hopelessness. Other core symptoms also differ. In prolonged grief, intense and persistent longing for the deceased person is a core symptom, which is not associated with depression. In depression, the patient will experience a generally lowered interest in or ability to enjoy everyday activities, while prolonged grief will involve a persistent preoccupation with the deceased, often accompanied by positive emotions or an intense longing. It is also common for the bereaved to seek sensory experiences that bring them closer to the deceased. For example, by using their clothes to feel their smell or listening to the voice of the deceased on a mobile telephone, recording, presumably. And when you listen to that, when I read that, I mean, it is so sad. And we have people wandering around who are out there right now and they're not getting the treatment, they're not getting the help, they're not getting the support maybe because they're not talking to people. So again, I always encourage people to talk to someone. If you're struggling, speak up, speak out, connect. And if you think someone may be struggling or has gone quiet, ask them how they're doing and ask the question again and again. Find out how they are. Let's strike up those conversations. And of course, if you recognize any of these signs in yourself or someone else, then not only speak to a friend, but if you possibly can, access professional help. Because now that more is known about this type of grief and it has been categorized and it is in the diagnostic manuals, then the mechanism, the pathways, the approach, the support route it's there. So please, don't suffer in silence. For the moment, for me, bye for now.